Thank you, Venkat.
Thank you. Thank you.
We next move on to our third session for today is on electronic medical records, cloud packs. So these two we have two speakers for this session. We have Dr. Karthikeyan Raju who's a medical director of Konganadu Hospital at Coimbatore. He has an MBBS from PSG and an MS General Surgery from the Maulana Azad Medical College. A very active advocate for the introduction of electronic medical records in the healthcare sector. He has quite a lot of information on that. He will share with us how EMRs can best and most practically be implemented in the hospital. Supporting him on this talk is Mr. Suresh Shenoy from Acme side. So Mr. Suresh is a MPhil in healthcare management. He heads our entire projects division. He has a senior vice president. His main area of interest is medical equipment and technologies. So he's trying to marry that interest with the digital technology that is coming in and how these technologies can be used to improve hospital efficiency and safety of patients. Over to you, Suresh, and Dr. Karthikeyan. Over to you, Suresh.
Ramdev, we talked about what TATACom does it, etc. You know about why TATACom and what, so we will not get into it. I have a question to Dr.
Karthikeyan.
Right, Karthikeyan ji, for while you are using this solution, sir. Now,
Yes,
do you think, Dr. Karthikeyan, that we should, or the hospital should focus on digitalization? Or why should I move on? I have an EMR, which is open source, which is low cost. It's okay. Let me use it. Why should I invest money or time, effort on this, sir?
Sir, good evening to everyone who has joined this meeting. Sir, two things. One is electronic medical record. That is going to be the future, sir. Actually, our whatever we are doing in India is far behind compared to countries like US. So, so these things are there. If you want to start my video, I think I'll have to connect from my phone. Is mandatory or just talk is enough? Do you want to have my video? There's hello,
Doctor, that will be better. But however,
yeah,
while you are,
I'll rejoin.
Okay, while Dr. Karthikeyan is about to answer the question that we asked, Mr. Suresh,
Yeah, Suresh, can you just come in, Suresh? Hello, Suresh, can you hear us? Hello.
Okay, while Suresh is probably facing some technology issue, that is where we have to be very cautious about it, and that is when our product is also cautious about it.
Yes.
We already think of how do we, like, let's say, this is a good example, like one doctor is not attending. We have in our product, if you have multiple doctors connected for giving a service, then the doctor can pick up. Okay, sorry, Menon, for mentioning that.
No, that's
now,
fine.
why?
I think we need backup doctors for that.
No, sir, like I'm saying, if there is a pool of, see, the most important point here is enabling digital is not a challenge at all. Anyone can do it. But do you have a necessary flow? Were you considering both? One is at the other side of a patient, another side is your doctor. So we need to marry both of them. Otherwise, your success of your product may not be effective, is what I'm trying to say. So should I continue, or Dr. Karthikeyan has joined back now?
No, he is not joined back. So I think you can make your presentation, Mr. Ramdev.
Yes, I will go ahead and ask this question to all of them. Why an healthcare facility and why we need this? Do we really need it? We have all HIMS solution, but are we digitalized? We have an answer. The answer is there again in this COVID era. What was the answer? The answer was many CEOs. I don't want to name the CEOs of major hospital chain hospitals. They've said, no, we do not have an integrated digitalized. So what we have right now is to make sure we are comply with certain policy. We make sure that we are having a patient who step in next time has certain relevant information. But can I make use of it as quick as possible? No. Why? Still, I do not have a crowd management and cannot make my patients happy, because that is we saw in COVID situation. Am I saying that during the COVID situation, there is a spike? So after COVID, everything going to get normal? Maybe that could be a blessings from all of our prayer, and we pray it also. We don't want it because to sell our technology. We want pandemic because to sell a technology. We want to create some problem. What we are trying to say, the patients are always needed a satisfaction when they come in. Can I have a relevant information, even for registering, even for making sure that the cash counter, registration counters are not queued up, right? If an emergency patient is coming and he's been attended, may not be emergency, but we might see that emergency room is there. That emergency ward or emergency entrance is basically for whom we think that those who are going to die. But what happens in a patient, if small clinical and headache or a heart pain, a chest pain, it could be because of gastric. But if that pain longs for some time period, yes. Hello.
Hello.
Yes, this is Dr. Karthikeyan.
No. I'm waiting. If you once you are done, then I'll talk. No problem.
No, you go ahead, Karthikeyan, doctor. We wanted to answer, then we can. Please go ahead, sir.
Hello, I am Suresh.
Yes, sir. Yes, sir.
Yeah, Suresh, you have come back online.
Can I come?
Yeah, sure. But Dr. Karthikeyan just started speaking. I mean, yeah, Suresh.
Yeah, Suresh sir, let Suresh sir start up. And
Suresh, just give an overview of the topic.
Yes. Yeah. See, basically, like, you know, these subjects, like, you know, this terminology like EMR, HIS, EHR, and cloud packs. All these things are almost familiar with many of those participants. If you look at the HIS, if you look at the last 2-3 decades, you can see that it all started with certain eras. The last decade, you can say that okay, it was an information era. So there are a lot of informations coming, and we have been recording it mostly by manually. We have been doing it, but there has got a lot of limitation with respect to the usage of that information for some particular purpose. So then it went on, and the next decade came. Then the tech era has come. And then technology started using various and several methods to how to store, how to collect and store, and then use these informations. And later on, then again, now the present decade, if you can look at, it is something like digital. It's a digital era. So if you look at all those kind of these things, there is a evolution which has happened. How to collect, how to store, and how to use the informations. So when you are talking about EHR and EMR, many times we have seen that many of those people are using this terminology quite often. Interchangeably, they are using it. And if you look at, even though both the EHR and EMR has got certain common characteristics, shared characteristics, but there is a subtle difference between EMR and EHR. So for the participants' benefit, if you are understanding exactly what EMR and EHR, then it will be helpful for you to understand the technical aspect of these things. Even though both are electronic or digital records, they are actually a means to create a legible and organized recording for future use to access the clinical information about the individual patients. Both EHR has been described as an important tool to reduce the medical errors and also improve the information sharing among physicians and also with the patients and those other stakeholders. See, the thing is that when we are talking about EMR is basically, it is a digital version of the patient chart and which stays within the hospital. Normally, say for example, if it's a single specialty hospital, what happens? Maybe he may be an ophthalmologist. When he is treating something, he finds out something else, and then he have to refer the patient to another hospital, or maybe a multi-specialty hospital where they are not having a particular specialty, so they have to refer outside. So in that case, we have to go for electronic health record because it contains more from the multiple hospitals. It will be recording in the EHR, so that whenever the patient goes to any place, the EHR also moves along with him. So that is the basic difference between EMR and EHR. So the question comes is that, okay, which one I have to go for, whether it is EMR or EHR. So the basic thing is that, again, it depends upon various factors like, even the amount of investment what you have to do, and also the what is ideal for your practice. Only if it is nearer, then you have to go for that. So mostly what happens
Suresh, in this one we are sticking to EMR. We cannot get to EHR. It's only EMR.
Okay.
Yeah, EMR.
Okay.
electronic medical records of the hospital. Yeah.
Yeah. So see, EMR is much easier than the EHR because no, it is confined to this thing. And also now the national, even Mr. Ramdev was also talking about the National Health Authority of India has recently opened a center called as National Health Information Technology Center. Basically, it is to promote the national health IT infrastructure, and also it recommends that all hospitals have to start using EMR and EHR in a later phase, maybe in a phased manner. And if you are looking at very recently, the Ayushman Bharat is also making this EMR for all those hospitals, all the network hospitals. And especially for the maternal health. So this shows the importance of EMR and how all the hospitals have to slowly,
Yes.
move towards the EMR. And
I think
similarly,
with, yeah,
cloud
with
and
that
cloud packing.
overview, we can have, I think, Dr. Karthikeyan also come in with that overview. Yeah, Dr. Karthikeyan, would you like to come in?
Sir, yeah. Sir, actually, speaking about this technology, so what is the thing is, EMR and EHR, as sir was telling. So what I would say is, everybody should first go for an EMR, but that EMR should be ready to be integrated in the future and become an EHR. That is my first introductory point, because there are many EMRs which many hospitals are currently using, and there is a limitation in all those things. See, for example, there are cloud-based solutions and there are standalone solutions. We were previously using a standalone solution. I think 20 to 30% of the hospitals will be having a standalone solution. That is, a standalone solution is nothing but the software is running in your own hospitals, in your own hospital premises. You have the software company will give you a server, and the server will store all the information, and everything is in your own premises. You are not dependent on anybody. So this is a standalone service. So this is actually not a good option. We have previously used that. Many problem points here. What we face is that you should have one permanent IT person who is taking care of all these things, and the data security and the data redundancy. That is, for example, you can have 2 years of data and suddenly something crashes down, and all the data is gone. Whereas in a cloud-based solution, data security is good, and the data redundancy. That is, even if there is an outrage, data outrage also, your data is kept safe at multiple locations so that there is no loss of data. And the third thing is, so once you're going as you're scaling up, for example, starting you might have a 50-bed hospital, and suddenly you are increasing your capacity, going for 150 beds, 200 beds, 300, 500 beds. Slowly you're scaling up. At that time, you need to scale up the technology also. You have to speed up the server. Every time you have to keeping on investing in that. So many people think that if I put my own server, I don't need to invest a lot. It is a one-time investment only. Then no investment. That is actually false information. A one-time investment is for the current year, and after 2 years, 3 years, you have to increase the space. You have to increase the speed of the server, and some server spares will go, and you have to replace the spares. So many things are there like that. So a standalone solution is actually, in today's scenario, it offers not much of an advantage. Some people might say that, sir, the data is with me. I don't have to share the data to somebody else, to a third party. So actually, if you at the end of the day, if you see that if at all, you feel that your data is very important, that your clients, your patient data should not be given to a third party or anybody else. So it is not like that, sir, because if at all in your own hospital, you can have somebody who's using the software. At a fraction of a second, they can export the complete data of all your patients and give it to somebody else. So it is not like that. It can be 100% secure. Nothing is 100% secure. So just because of that one thing alone, if you are going to invest and have everything at your own place, it doesn't. It's not. There is no meaning for that. So today's scenario, everybody should start moving to a cloud-based EMR, cloud-based solution. So this is the first thing which I am putting forward. The second thing is EMR. EMR, what we had in India 5 years back, and EMR what we are having right now, they both are completely different, and what we will have in the future will also be a different thing. So these things what the current world and everybody are doing is everything is going to be computer based. Everything is going to be keyed in. All the information is going to be keyed in. See, previously and even currently, most of our practitioners are used to write everything in a paper, and most of our all corporate hospitals and most of the hospitals are like, they will just have a scanned version of whatever the consultant has written, and it will be uploaded in the hospital information system. This is what they call it as electronic medical record as per Indian version. As per Indian version.
Absolutely.
Because sir, what is the problem? Many people will say, sir, anyway, the information is there in the computer. What is the problem? The thing is, the information is there, but the information can be accessed only by the consultant. See, my own handwriting, only I can decipher it. My own, whatever I have written about a patient, only I can decipher it. Somebody is some other doctor or some other consultant cannot decode whatever I have written. Whereas if you are going for a computer-based system, everything will have a flowchart, everything will have a text. So even if you are going to prescribe an investigation, it will be like you are going to select the investigation, it will be prescribed. So it is a transparent thing. The patient can be transferred, the patient can be referred by any consultant in the future. So
Thank you, doctor. Doctor, I would like to appreciate, I wanted you to come back and join Tata Communication. Because the support this, like you talked about what not, you talked about what are the challenges. Looks to be that you have faced a lot of challenges. One, I appreciate Mr. Suresh has talked about what EMR and EHR, everyone might be known at this moment. And you said that EMR is the primary and EHR is your higher education. So right now, EMR is basically from an LKG to 12th, which is inside. See, this is like you relate everything towards your student or your, your baby. See, EMR is basically within the office or within the home. So you make sure that your kid, which is your hospital or your business, go through EMR and which is confined one. Now, when you say EHR, he is exposed to the outside world, which is nothing more. If you wanted to make sure and scale up your business by making sure you integrate with various other parties, it could be a radiology solution, it could be a clinical solution, it could be a EIC solution that you want to give as a service or you want to take that as a service, this particular insurance for the matter, this platform is essential. Along with that, now being the policy is going to be made mandatory, so far we did not have. Tata Communication, along with our various healthcare partners, we would like to specify that your data and your technology, if you don't want to reinvent a wheel again and again, we can provide you a software as a platform and a managed service by which your hospital management system, along with various technology, it could be telemedicine, it could be EICU, it could be e-ambulance, whatnot that you wanted, even IoT enable hospital service that you want to track your asset. That one incubator, which is right now in a clinic, a ICU, you want to move to EICU, you want to understand where it is. These all are possible. Technology is there as a service provider. We would be able to enable this for you, and we already enable certain products along. We can customize for you if it is required.
I just have one question for Dr. Karthikeyan Raju.
Yes, sir.
You move to a total electronic system, which means, let's say, a paperless hospital. In fact, which is ultimate. How does it actually benefit the clinician?
Sir, moving towards everything paperless, one is you will have a mobility. For example, whenever a patient is booking an appointment with you.
Yes, absolutely. From there it starts, I think.
The future can like, so I think I'm clear, I'm getting a call. So the future can be like, tomorrow I have all the patient's appointment is fixed. I can give an appointment confirmation from my own phone, And once I confirm the appointment, once at the click of a button, I'll open patient number A, patient A, and patient A, I can know the complete database of the patient. What was the first time he came with what complaints? So what was my inference out of it? What is the investigation I prescribed? What was the results of it? What was the medicines I had given him? And how many times he had visited me in the past? How well did his problems resolved? And what is the current status of him? Everything can be at my hand or in my own computer, even before the patient is going to visit me. So once the patient is going to visit me, it will just take few seconds to just see him, assess him, and give him medications. This will help to speed up the process of seeing. Initially, yes, I know that initially you have to enter all the information in the system. Initially, it will take some time, but the fruit of that will be enjoyed once the patient is going to visit you again and again. The first time, yes, there will be a time gap. You have to enter all the information, but once the system is understood, it is very easy. So it is just like how you are writing letters, even how you are difficultly typing messages in WhatsApp. Now you are just sending a voice note.
Yes, exactly, doctor.
Right now there are type.
Right now, to support healthcare industry, doctors and nurses, there are various tools like voice recognition, convert voice into a text. These all are enabled. So yes, in future, many more like if you have an existing data which is printed as an electronic record, that is also can be converted into digitalized. So there are methods, but of course, a written prescription sometimes that cannot be converted. But 90 to 60 to 80% I saw in one project, we were able to migrate the data.
Yeah. See, there is handwriting recognition, there is voice recognition, everything is there. But once we start keying in things, it will be more easier. But that is going to be the future. We cannot escape from this reality.
Doctor, how do you see the scenario in IP in inpatients? How much of can we actually get the entire medical record, your daily consults, daily assessments,
according to inpatient, only two things. Sir. You have to make your nurses and your doctors go digital. So go as you say, doctors, they have to key in their notes, and nurses, they have to key in their notes. The only thing is, all doctors, for example, they will have a specific set pattern. Like if they're going to see the patient, they'll write the patient is fine. He's having no fever. He's not anxious today. He has passed his stools. He has passed urine. Each doctor will have a specific format of whatever is going to assess from the patient. Once the specific format is put as a template in your EHR or EMR, once the doctor is going, everything will come like a checkbox. He has to select, patient is conscious, patient is not having fever, patient has passed his stools today, everything. Doctor will have to take his tablet outside and he has to give all the checkpoints. And then he has to just write a few words, he has to just key in. Even if that will be difficult for him, he can do a voice. He can just record like a voice note. He can just put a note. I have seen this patient is doing fine today. He is doing his second day after surgery. His vitals are fine. He's planned for discharge tomorrow. He can just tell this, and in the background, the system can recognize the doctor's voice and it will do all the typing for him. This is going to be the future.
Doctor, I would like to tell you, there was one of a doctor who earlier joined. He said this is a COVID era for hospital industry. So who is this now? When this template, why it is not ready? Were we doing this healthcare industry the first time? No, we are practicing for how many years right now, doctor? 150 years, 200 years? In India, at least 100 years. Now, why we are not? So far, this was not digitalized. Can we take an international data and feed into India and say that do a prescription, doctor, do everything? It may not be right thing to do. We should know our own hospital, our own people record. So now this is going to be the start. If this data are being entered for by Indian doctors, I'm sure in another 6 months or 1 year or 2 years line, there are lots and lots of templates. Artificial intelligence can make use of the data and ensure we can effectively manage the time off, or we can give a tool to various doctors and healthcare providers by which they can effectively manage. But there has to be some start.
Sir,
I would prefer let this be a start.
as simple as that, sir. Many people would know medical transcription industry. Medical transcription industry was dependent on US and Australian countries for the alternate transcription. Now, why is that industry down? Because they themselves have started keying in the information.
Right.
The doctors have the doctors in US have started adapting EMR and EHR more than what we are doing over here. But see, whatever is being practiced in the Western countries will come to India at a later pace, but it is sure is going to come. But this is the apt time. Once we start adapting all these things, and we have to start going towards a completely digital solution, and that is the betterment for the treatment of all our patients. And yes, it will be soon made mandatory also, as being made mandatory by the government. So adapting.
I would, Doctor, while I say mandatory is all good, government is trying their best to ensure that certain things have been followed, but the mandatory has to be, everyone is going to get benefited, as you mentioned. It is the doctor and the hospital who is going to benefit, because you are saying to a patient, don't worry patient, come up without any files. You come here, we have all the information with you. And just imagine when a patient is coming in front of and sitting for an OPD with a lot of pain in his hand, in his body. You are asking him, take me that file, this file. Instead of which you say, Acha, hi, Mr. Suresh. I saw you are faced last time also with the same stomach problem. We gave you treatment and you said you were having an eating problem. Why can't you reduce it? Why are you continuing this? Maybe he is shocked and think why he will leave you. That is called, see, earlier, let us take this example as like the
EMR, once these things are computerized, everything, even before the patient is going to come to you, he can key in these symptoms, like these are the complaints I'm having. So the doctor, even before the doctor is going to see the patient, he can tell, once you come in the morning, before meeting me, you can do all these tests and then meet me. So this saves time for the
Karthikeyan ji, this Dr. ji will go like this. Dr. Karthikeyan sitting at a remote place, he will go with the AR, VR. Once you key in all your pain problem, Karthik would be there on this mobile. Hey, hey man, how are you, Suresh? I'm telling you, I'm Dr. Karthik. You visited me last time. And this is the medication we gave you. Now you continue it. Why do you want to travel? Sit down, man, relax. Nothing to worry. See this change.
So I think we are coming to the close of the session, Mr. Ramdev and Dr. Karthikeyan. There is just one question that there is there for you from the panel, Mr. Ramdev, that in case we have an existing HIS, how can that be integrated with your EMR? And is it very easy, or do we have to replace the whole thing?
Yes, very good question. When you say EMR, always any data which is available can be migrated from my Excel till then. Customized Word document can be also gone, to an EMR update in our file complaint platform. So I would say, a simple answer, it should be very simple rather than writing a note of complicated manner.
I think we've come to the end of the session. There are any closing comments, Dr. Karthikeyan, any closing comments, sir?
One more thing. It will be
Suresh, please.
It will be helpful for all the participants that if Mr. Ramdev can give us an idea about what will be the cost involved in this, a little bit of something.
Sir,
like
I would like to say, as it's going to be a cloud infrastructure, when we did a calculation of one-off POC customer, that we did it at for 1,000 bed, it was coming around 30 lakhs per month. When you say 30 lakhs, that is included of manpower supporting at the ground, who can convert all their physical document to a digitalization. So there is a cost associated for it. An approximate for a bed of 1,000 bed is coming for an 30 lakhs in, and 100 bed or a 50 bed or a 10 or a whatnot. I'm not sure about going beyond 50. It should come around 5 lakhs to 6 lakhs or a 3 lakhs.
It will proportionally come down.
Yeah, so come down. But there are some minimal component as an implementation based on this. So we do a feasibility study. We would ensure, and Tata Communication interest is, let me be a friend, Tata for the brand. We wanted to make sure, be in this journey and convert this digitalization at a lower cost. Let us not get all the revenue generated at the first time. We don't want that intention. We want to be a long player. We will ensure your data is secured. We will give you an effective, comprehensive price based on the assessment of your platform.
And you are prepared to give this also on a monthly basis so that they don't have to have a initial large capital.
Exactly right. Monthly basis, so that you don't want to worry about how many huge cost initial.
Anyway,
A
thank you very
subscription
much.
model.
Yeah, thank you,
Thank
Dr.
you very
Karthikeyan,
much.
very much. Thank you, Suresh.